Hello everybody. We are here tonight to talk about acid reflux and heartburn. GERD is included in that. A lot of people think of it as GERD. So I'm Dr. Lisa Gordon here at the Natural Health Improvement Center of Columbia, Maryland at the Atholton Shopping Center. And I'm thrilled to be able to come to you virtually. I'm so glad that we have this available to us. Usually we do these talks in person, and I so look forward to having you come and be in the new office with me and learn about lots of different topics that we talk about. So tonight we're going to be talking about acid reflux, and we're going to be also discussing how to stay well. It's so important right now because we're confronted with this virus and this quarantine and all of these things that are so unusual for us. So what I want to start with is to talk about how important it is to stay well. So instead of letting yourself get sick, why not stay well? Well, what's the best way to stay well? Of course, it's to feed your body well and to give yourself good nutrition. It's so tempting right now to go and drink alcohol and to eat a lot of sugar, and you'll be confronted with your refrigerator and with your pantry and whatever's in there. It's so tempting. I know, because I worked at my home for 8 years before I moved to this office, and it was really tempting at every break. Oh, the refrigerator was right there. What shall I have to eat right now? And so on. So I really get it, and I want to start educating you. So what we are implementing now in our office is a wonderful new nutrition coaching program. So if you're interested in not only getting rid of your acid reflux, but also staying well and continuing to learn how to be well for the rest of your life, please give us a call, because we are having really amazing specials. We know that money is an issue for some people right now. We're offering really great specials on this very affordable program about nutrition coaching. So it's usable, it's useful, it's fun, and you'll get a lot of information. So call us at 410-717-6610 and talk to Gabby. She's going to be implementing that program, and we're really looking forward to offering that. So on to our subject of the night, acid reflux. About 30% of people in this country have acid reflux. Part of the reason is because we're not really sure what to eat. A lot of people are eating things that are causing distress in their stomach, and they just don't know exactly why it's happening. Some people even get the problem so badly that they get this acid coming up into their chest, and a lot of people even think that they're having a heart attack. This is not the time to go to the hospital, folks. We do not want you going to the hospital. It's the most dangerous place to be right now. There's a lot of sick people there, and I don't want you getting this virus. And even more importantly, I want you well. So let's talk about that. What happens when you're getting that acid coming up into your chest, back up into your esophagus? Well, it could be one of two things. The first thing that it could be is that you might have what's called a hiatal hernia. And what that means is that the valve at the top of the stomach is not closing the way it should, and so the natural acid in your stomach, which is supposed to be there, is coming back up through this insufficient valve, and then that comes up into your esophagus, and it burns like crazy, and it's called heartburn because it feels like your heart is burning. It could cause burning up into your neck. It can cause burning into your back. It's very, very unpleasant. And a lot of people know that it's heartburn, and so what do? They take a Tums, they take something that's going to reduce the acid. So that brings us to the next issue that might be causing acid reflux, and that is actually a little counterintuitive. In other words, you might think that it's the opposite of what it actually is. So what actually happens as we get older is that we lose the acid in our stomach. Well, what's the acid there for? The acid is there so that we can break down the food that we've just put into our mouth. We've chewed our food. It's very important to chew your food well, because then your stomach starts knowing that there's food coming. So it produces the acid, the correct kind of chemicals in your stomach and the correct level of acid, so that it can break down those foods into tiny cell molecules that can then go through another valve at the bottom of your stomach, or near the bottom of your stomach, that only opens when the stomach is at a particular level of acidity. In other words, if you have too little acid in your stomach, that food is going to sit in your stomach, and it can cause reflux because it's just too full, and you don't have enough acid in your stomach to allow that second valve at the base of the stomach to open and allow those nutrients from the food you just ate, even if it is good food, to go through into your small intestine, where you can then absorb it and then use it for your cells and for your organs, for your nutrition that you need to stay well and stay alive. So, what have we just learned? We've learned that the stomach needs to be in an acidic state. You need to have very high acid in your stomach. That's the natural state of the stomach. So, if you don't have enough acid in your stomach, and this can occur because of aging, it can also occur because some people actually drink something called alkaline water, which I have mixed feelings about, because certainly if you're going to drink alkaline water, which is, if you remember back to chemistry, if you took chemistry, acid and alkaline are opposite to each other. So baking soda, for instance, is alkaline and vinegar is acidic. And when you put them together, you get a little volcano. So the reason for that is because they react with each other. You don't want an alkaline stomach. So even if that alkaline water is good for some people, please don't drink it while you're eating, because it's going to cause problems in your stomach. It's going to cause your stomach not to be able to digest your food. And if you can't digest your food, guess what? You can't use the nutrients that are in the food because they just don't break down. You end up with a full stomach, so that it can't go into the small intestine and get distributed where it needs to go, absorbed in the small intestine, and then distributed where it's supposed to go in your body, wherever those nutrients are supposed to go, because your body's smart that way. So what people can do to increase the acid in their stomach, and don't be scared to do this. The only time it's not a good idea to do what I'm about to describe is if you have actual ulcers in your stomach. So here's what to do. Take a little bit of apple cider vinegar, and be sure to get the best one. Be sure to get the one that says with the mother, because if you get the one that says with the mother, you'll also be getting other very good things for your digestive system, the probiotics. So I know you've heard about probiotics, and if you haven't, they're really important. They're important to the intestinal lining. They're important for your health. So to keep the bacteria, the correct amount of good bacteria in your gut. So apple cider vinegar with the mother is what it says, and it's cloudy at the bottom. There are a couple of good brands. I usually buy the one called Mrs. Bragg's because it's very reliable. There's another one called Eden, and there are a lot of different ones. But you want the one with the mother. Don't worry about that cloudiness at the bottom. It's supposed to be there. Those are the probiotics. So go ahead and take a little bit of apple cider vinegar. This is a home remedy. I want you to be able to do this yourself while you're quarantined. So take a little bit of apple cider vinegar, and you can drink it with some water, or you can put it on your food. I love to make a stir fry, and then at the end of making the stir fry, I just pour a little bit, a tablespoon or so of the apple cider vinegar on on the food, and it just sparks it up. It makes it really nice. It's kind of like putting lemon on, but you also get the extra benefit of having the good acid for your digestion. And then just see if your digestion gets better. Some people like to use the apple cider vinegar by taking it in a glass of water in the morning. If you just want to take a little bit, a tablespoon or a teaspoon, anywhere from a teaspoon to a tablespoon of apple cider vinegar in your water in the morning. Sorry about that light thing that just happened. I have automatic lights in my office, and if I'm not moving enough, they just go off. So Gabby just turned it back on again by moving up front. So it's, we're getting used to this place. Anyway, so they should stay on now for the rest of the talk, hopefully. Anyway, so drink a little bit of apple cider vinegar in water, not a lot, a tablespoon, and you can do that a couple times a day. You can just do it with your food, pour it on, use it on salad, use a good bit of apple cider vinegar on salad. Now, balsamic vinegar doesn't work quite as well. Other kinds of vinegars don't work quite as well. I'm not sure why. It could be because of the level of acidity. I'm thinking it might not be quite the level of acidity that you need. Or it could even be that the probiotics in the apple cider vinegar that says with the mother is really that much better, that it's going to give your body exactly what it needs. So it could be that that's all you need to correct the problem. And the other thing is to clean up your diet. So you want to eat a lot of good fresh fruits and vegetables. There are good foods that make things worse. They're better, and there are some that make them worse. So things that help are, and I'm just going to read this. You'll see me looking down a little bit. Berries, melons, bananas. Vegetables like spinach, kale, bok choy, broccoli, green beans, asparagus, cucumbers, lean proteins, eggs, chicken, turkey, healthy fats like olive oil, sesame oil, or even olives, sunflower oil, avocado oil, fatty fish like salmon and trout. You can see the fats are really good for you. Oats are good for you also. Ginger is very settling to the stomach. Aloe vera is very healing to the tissues of the digestive tract. Avocado is very good. And then once again, the regular consumption of the apple cider vinegar with the mother. So some of these things have to do with actually healing the gut. I did mention before that the one time you shouldn't do the apple cider vinegar is if you actually have ulcers. So let's say you try this apple cider vinegar. Start by trying just a little bit, because some people actually do have ulcers. If for some reason you try that apple cider vinegar and you get a severe, pointed, localized pain, in other words, a pain in a very small area that's really severe burning, that means that you might have an ulcer, and we may need to work on that by way of nutrition response testing. And the acid reflux is also something that we treat very, very successfully with nutrition response testing. So if these home remedies aren't working for you, it's not a hopeless case. And in other words, we can help. Things that make the acid reflux worse are things that have bad fats in them. So things that have been fried, and you end up with rancid oils. Too much dairy bothers some people. Too many grains bother some people. Sugar will really throw off the acid in your stomach, and so that will cause you some difficulty. High-fat creamy salad dressings can cause trouble with some people. Some sauces and dips, some spicy things can cause trouble. Sometimes high-fat cuts of meat can be troublesome for some people. And citrus fruits can be difficult. And this isn't for everybody. Some people can eat these things with no trouble. Alcohol is a problem for a lot of people. Tomatoes, onions, garlic, mint, caffeine. These are things that might cause you problems, and they might not. So just start paying attention. A lot of people find that it's useful, as we do with nutrition response testing, we have people keep a food journal. And so if you were to keep a food journal for a week, let's say, and write down everything you eat, and also write down what time you get that acid reflux, if you get it, then you can learn a lot about what kinds of foods might be causing you trouble, because not everybody's the same. And nothing that we do in this office is cookbook. So those of you who know me and who know my practice, you know that everything we do here is individualized and every single person's body is different. There are certain principles that we follow, but everybody's body is different. So let's talk about the medical approach to acid reflux and why it doesn't make sense. I've given you a lot of home remedies and things for you to pay attention to, and I want to go back to why the acid reflux is occurring. So with the hiatal hernia, let's say that valve at the top of your stomach is not closing the way it should. That's a fairly simple, in most cases, by far most cases, that's a fairly simple thing that a chiropractor who is trained in how to correct a hiatal hernia can do a lot of really good work with that. So I do that on a regular basis with my patients. It's not a difficult thing to do. We adjust the spine. We make sure that the nerves that go from the spine to the organs, to the stomach in this case, are working the way they should. And we also actually work on the valve itself to make sure that it can open and close the way it's supposed to. So that's one thing that a chiropractor can work with. And if you have acid reflux, sometimes people think, and I have many patients who've gone to doctors who've given them acid reducers of one variety or another. Well, I've now taught you about why the acid in the stomach is so important to have. And so, does it make sense to reduce the acid in the stomach, or does it make sense to normalize the acid in the stomach so that the food can be digested? So those acid reducers are actually the opposite, in most cases, the opposite of what a person needs. So it does take some time for somebody to work with their medical doctor to get off of those acid reducers. If they're over-the-counter things, I think that you can do that yourself. And with the proper coaching and with the proper support nutritionally, with the proper supplements, with the proper dietary changes, it's very possible to go back to normal digestion. So I get very concerned when people are on those acid reducers for longer than the time that's recommended. And if you were to look, if you're on the acid reducers and you're to look in the literature about the particular medication, you will see that it's not recommended to stay on those longer than 2 or a maximum of 6 weeks in most cases. I have patients who've been on them for 20 years, for 12 years, for 10 years, for 5 years, whatever it is. And I've had patients who have actually ended up with very severe health issues because of being on medications that perhaps they didn't need to be on. So I want to help you avoid that. Please do consider what I've been saying. Know that you can do a lot at home, and I really want to be able to educate my community to be the best they can be, to be healthy. Every single person has something to offer, has a smile to give to somebody. Every single person has a talent to offer, even if it is just smiling at somebody, being kind to somebody. And if you're not feeling well, if you don't know what to eat, if you don't know how to be well, it's going to really be hard for you to give your God-given gifts to the world. And I think we all deserve to know who you are and what you have to offer and to benefit from the light that is within you. So please understand that that's what I'm here to do. I'm here to serve you so that you can be your best self and give your best self to the world. Give us a call here at 410-717-6610 and look at our website, check out our Facebook page right here where you are, and be part of our community. We're going to be doing this nutrition coaching, and we'd love to have you be part of it. So call for details. It's been wonderful spending a little bit of time with you here, and if you have any questions, we're here for you. Take care. Bye-bye.